The ACL is probably the most important ligament of the 4 in the knee. It keeps the knee nice and stable, so it prevents people from having their knee buckle or give out on them when they're doing any kind of cutting or pivoting. ACLs, I think people think that you have to be tackled or something happens to you, but oftentimes somebody can be running down the field and just either step wrong or go to change direction quickly, and that's enough to tear the ACL. The ACL is treated based on age and activity level. So the younger the patient, the more active they are, the more they really need their ACL, the more commonly that population will end up having surgery. The older population, and if they're more sedentary, it's less likely that they'll need surgery, and they often do well with just non-operative treatment. So non-operative treatment of ACLs includes physical therapy, sometimes bracing, sometimes activity modification. But in my younger athlete population, they often need surgery, and that happens using one of their own tendons to replace the ligament, and that allows them to return to their sports, particularly cutting, pivoting sports like soccer, football, lacrosse. For my young athletes that have had surgery, return to sport is a minimum of 6 months. They have to have their full motion, full strength, and it needs 6 months on the clock after surgery so that the new ACL that we've put in there has regained its blood supply and is able to sustain those same forces. Interestingly, my patients that don't need surgery, those are often my older athletes. They still take up to 4 to 6 months to feel like they're back doing most of the things they would like to be doing. The other interesting thing is my athletes, even though I send them back at about 6 months, they will tell me that season they feel okay, but the following season they feel even better. So the ACL continues to mature and their leg continues to get stronger and better over time.